Hi everyone, welcome to my channel Mon Med Ed, where I talk about high-yield medical school content. This video is going to be on thyroid cancer. Papillary carcinoma is the most common type of thyroid cancer. On histology, you're going to see orphan Annie nuclei, which is the image on the top. This basically will be cells that look empty almost, like the orphan Annie image that's shown next to it. You're also going to see nuclear grooves and posoma bodies, which is the image below. On clinical presentation, it'll most likely be a patient with a history of ionizing radiation in childhood. That's a really high yield association with papillary carcinoma. The second is medullary carcinoma, and this is a proliferation of follicular C cells which secrete calcitonin. And it's high yield to know that this will deposit as amyloid in the tumor, which means it's going to stain with Congo red. For clinical presentation, it'll most likely be a patient that's presenting with hypocalcemia and a thyroid nodule, since calcitonin will cause hypocalcemia. It's also good to know that this is associated with MEN2A and MEN2B, which are mutations in the RET oncogene. So just for reference at the bottom, I listed out that MEN2A is associated with medullary carcinoma, pheochromocytoma, and parathyroid adenomas. And then MEN2B is associated with medullary carcinoma, pheochromocytoma, and mucosal neuromas. Follicular carcinoma is the proliferation of thyroid follicles that invades a fibrous capsule, and this is really important to know for this type of cancer because it's going to distinguish it from follicular adenoma. So in this histology image, you can clearly see that the thyroid follicles are invading the fibrous capsule, and this is pretty much all I feel like you need to know for this type of cancer. And then lastly, anaplastic carcinoma. It's pretty much high yield to just know that this is going to be in an elderly patient that might have difficulty swallowing or breathing and with a thyroid mass. And it's also important to know that this has a poor prognosis. And that covers it for thyroid cancers. Thanks for watching.